And we will get started. Okay. So as I said, we're going to talk about the payers. Who pays for MoHealthNet? So once an individual is approved through MoHealthNet, they'll either receive coverage through fee-for-service or straight traditional Medicaid, or it's one of the managed care plans. So participants will go to their family support division. They will get enrolled in MoHealthNet through them, and then they will put them in one of these categories, and this is how they receive their services. So straight traditional Medicaid, that's going to be your adults, adults with disabilities, seniors over the age of 65, blind, visually impaired, and women with breast or cervical cancer. So that means that that population, they receive payment for their services through MoHealthNet. You will bill MoHealthNet for those services. Managed care participants are children, pregnant women, newborns, and families, which means that they will be assigned, or they can choose which managed care plan they like to participate in. It means their services, you will bill that health plan for those services and get paid through them. So MoHealthNet has 3 managed care plans. So these are the health plans that are responsible for providing benefits and coverage on behalf of MoHealthNet. The managed care plans will follow MoHealthNet rules and policies, but they can have their own processes. For example, MoHealthNet may require a prior authorization for a service, and health plans may not. They can have their own processes, but it's important to know MoHealthNet policy and rules so that you'll know what those health plans will provide to the participants. Okay, so another thing to note is that providers can negotiate the rates with the managed care plans. You can treat them like any other insurance companies. So you can choose which plans you want to participate with. You do not have to participate with all 3. This is really up to the practice and up to the providers on what they want to do, who they want to be involved with. Again, I'll say participants can choose which plans they want to participate in. If they don't choose a plan, then they'll be auto-assigned. I also want to let you know that participants can change plans with just cause. For example, they moved and there's no providers in their location, or they have special needs and they need a certain provider. Participants can change their plans with just cause. So it's very important to check their eligibility and make sure that you know which health plan they are with. So the first one we're going to talk about is Healthy Blue. For dental providers, you'll be working with DentaQuest. I've provided some contact information for them. Tanisha Bryant is a provider partner consultant. She's been wonderful to work with. Here is what their cards will look like. So when you have participants come into your office with Healthy Blue managed care, this is what their card will look like. They'll have a member ID and a DCN, and then here is their number for their dental services. So just something to be aware of, that MoHealthNet participants will not always have a MoHealthNet card. If they're with a managed care plan, they will have that card. That's the quickest, easiest way to know which plan they are with, but also be sure that you check their eligibility, because it may be an old card, they may have changed plans, they may no longer be eligible. So look at their cards that they have and then check their eligibility. Next, there is Home State Health, or you may hear them called Involved. The unique thing about them is that there could be 2 different cards. So Home State Health, this is what their cards will look like, has their MoHealthNet ID. It's really easy to identify that this is a MoHealthNet participant. But Home State also has the Show Me Healthy Kids. So Show Me Healthy Kids is for the kids in state custody or foster care. So what was happening is the kids in state custody or foster care, they would be assigned a managed care plan. And then, as we know, their situations change. So they may go to a different family who may say, well, I want this health plan, or I want another health plan. And the issue that was coming up was that they were changing health plans, and it was difficult for providers to coordinate that care. So the state decided to do the Show Me Healthy Kids plan so that all those kids will be in one plan. It'll be easier for providers to access their care and see what they've already received, see what they're eligible for. It kind of just makes their life a little easier. It also makes it a lot easier on those kiddos. So if you enroll with Home State Health, you are automatically also enrolled with the Show Me Healthy Kids. It is not a separate credentialing. Home State Health provides services for both plans. So cards look pretty much the same, but this one has this extra Show Me Healthy Kids. Show Me Healthy Kids also are eligible for a few extra services that they need, such as behavioral health services. So that is why they're also in that plan. Last but not least, we have United Healthcare. Patients may refer to them as United Healthcare Community Plan. They'll have this community plan here on their card. This is what their cards will look like. I provide information for their credentialing, provider services, and provider relations. These health plans have been wonderful to work with. They're very responsive to emails. They want to work with providers. But if for any reason you have issues reaching them or having getting in touch with someone, please let me know and I can help make that connection. So MoHealthNet, if they just have the straight traditional Medicaid, this is what their cards will look like. MoHealthNet up in the corner, MoHealthNet ID number, also called their DCN number. So you may hear it both ways. So it's important to know MoHealthNet about what MoHealthNet fee-for-service is. Even if, say, you're a pediatric dentist and you're only seeing kiddos, you're only really working with the managed care plans, you still need to know the MoHealthNet information so that you know what those kiddos are eligible for, what the managed care plans need to be providing, so on and so forth. So MoHealthNet provides education and training. So when you enroll with MoHealthNet, you can sign up for one of the trainings where they will take you through and they will show you how to check eligibility. They will show you how to process a claim. They will show you the dental provider manual, where to find all that information. It's really a great resource, and we really recommend that any new providers attend one of those education and training webinars. It's about a 2-hour webinar. It's very beneficial for any office staff who are actually going to be doing the eligibility checks or claims processing to get them that information. They can attend as many times as they'd like. It is a live training. They're able to ask questions, give specific any specific information they need to know, gives them great resources where everything is found on the MoHealthNet page. The MoHealthNet page has a whole page of provider resources. It's where you'll find the fee schedule. That's where you'll find when you're going to get paid. That's when you'll find the provider bulletins. Any information you need to know about MoHealthNet can be found at this link, the MoHealthNet provider resource page. So please, when we're done, be sure to go check out these 2 pages. There's a ton of good information. More than likely, any questions you have, you can find the answers there. If you have questions about MoHealthNet training or claims or anything like that, you can reach out to this MoHealthNet Division Education email address. They're very responsive, great to work with, and they can help you in any way that you need. So once you're enrolled with MoHealthNet, you've done the training, but you're just having maybe issues about a certain claim, or you just need to check and verify a participant's eligibility. They also have provider communications. They do have a phone number here, but you can also reach them through EmoMed. So EmoMed is the MoHealthNet portal where you will check eligibility and submit claims. They have a great feature there where you can talk to the representatives through there. You can send them a message and then they respond very quickly. That way it's all in one place. But if you'd like, you can call the provider communications number. It is a recording. You have to push in some options. You have to put in your MPI number to get to a person to talk to, but it's very helpful. And if you have any questions, you can always go through EmoMed as well. Okay, so I realize I went through that pretty quick, but I wanted to leave plenty of time at the end for any questions. So today, we're just talking about the managed care plans in MoHealthNet and what the differences are and how those participants are receiving services. We're not going to get into the ME codes or any of that stuff yet. That will be next week. We're just going to look at the plans right now. So I want to go ahead and see, are there any questions that I can go ahead and answer? You can put them in the Q&A box or in the chat box, either one. But what kind of questions do you have as providers about this information? If you have questions about credentialing, you can look back at last week's, sorry, it's been 2 weeks ago. We had a holiday in there. We had a credentialing 101. A lot of the credentialing information is there. Okay, so there was a question in the Q&A said, is EmoMed necessary if we're only doing United Healthcare? Yes. So if you're only doing United Healthcare, that's great. That's wonderful. They have their own portal. You can check their eligibility. You can submit your claims. I also recommend having the EmoMed portal because say you check United Healthcare for eligibility and it says they're not active. So what would you do from there? So you would need to go into the MoHealthNet portal, the EmoMed, and see, did they change plans? Are they no longer active? So the EmoMed is going to show you the overall picture. So that's also where you can talk to provider communications if you have questions about anything. So yes, you won't be using it as much, but I think it's still very beneficial to use that EmoMed portal just to back up in case you need to check eligibility. There was another question about how to check the UHC Medicaid portal. So you would need to, I'm sorry, let me close that. So you would work with UHC to get set up on their portal once you've credentialed with them, and then they can give you some training, some guidance about how to use their portal. They are all fairly similar. They can all do pretty much the same things. They may look a little different. So follow up with UHC or follow up with me for contact information for United Healthcare if you need more information about how to use their portal. I do also want to tell you that we recently did the managed care plans credentialing webinars, Missouri Coalition of Oral Health did, and those are on our website, the recordings of those and their presentations. So they also kind of walk you through the portals. That'd be a great resource if you wanted to get in and see what those look like. Do dental benefits vary by plan? So we'll start with that question. So knowing what MoHealthNet covers will tell you what the managed care plans cover. So if MoHealthNet covers it, the managed care plans will cover it. The managed care plans have to provide at least the services that MoHealthNet does. Are patients provided with benefit comparisons to make an informed decision about which plan they want to choose? So like I said, the managed care plans, they're going to provide the same benefits. So they won't get more services because they're enrolled with United Healthcare. They will receive the same benefits. Some of the plans do have some extra like incentives, like some of them pay for after school activities. Some of them have a few extra perks and we do make that information available to participants and they are able to choose their plan. But as far as the benefits, the same benefits are covered no matter what plan they're in. Okay, and then the question is, could a patient have 2 cards? For example, one from MoHealthNet and one from United Healthcare. I believe they shouldn't. They should only have the one they're eligible for. I am going to, sorry, give me 1 second. We have Amanda Ferendorf on today. I'm just gonna call on her to help me answer some of these questions. She's with MoHealthNet. She's the dental education representative, and she has tons of experience. So Amanda, participants should only have 1 card, correct?
They should only have 1 card. However, you know, if their eligibility's changed and they've changed plans, sometimes they may have held on to an old card. So I just recommend checking eligibility on EmoMed just to make sure, because they'll give you a card and then it might not be right.
Yeah, and we recommend that you check the eligibility of the day of service, just to make sure, do your checks and balances to make sure that they are still eligible for those. Okay, for For fee-for-service patients, are they under the ME code 11? Some patients are eligible. Okay. So we're going to get into more of the ME codes and what they're eligible for. We're going to tackle that information next week because it is a lot of information on their ME codes and what services they're eligible for. So if it's okay, we're going to hold that question until next week. The question was, for fee-for-service patients under the ME code of 11, some patients are eligible for dentures due to their Medicare plan, QMB, but if they have any other Medicare plan, it's not covered. Why is that? That's a very specific question, and we will try to get into that next week. For questions like that, I really recommend that you attend the Mo Health Net billing training. They will cover secondary claims. They will cover spend down. They will cover all those very specific things in their billing webinar because they have 2 hours to cover it. We're kind of limited on time today and also next week, so we'll cover as much as we can, but that one will take a little more time to address. So there is a Mo Health Net training coming up on the 20th. You can find that information right here at this education and training resources. You can click there and you can sign up for that webinar coming up on the 20th, and they will cover that information. Okay, so there was a question, will the eligibility checks tell you about specific services? So the eligibility check is just going to tell you if they're eligible for Mo Health Net or the managed care plan that they're with. For the specific services, that will depend on their ME code, which we will get into next week. Their ME code is what is going to tell you what services they receive. So we will cover all that information next week about what services are covered for what ME codes. Again, if you want to go ahead and get a jump start on that information, that webinar on the 20th with Mo Health Net will also cover that information. A lot of great questions today. We still have time. I know it's been I'm kind of limiting you guys today on just the managed care information. And I know that we want to jump into those codes and the ME codes and the services. The reason we separated the 2 webinars is it's a lot of information and we only have 30 minutes. So we're trying to get you the most for your time. But again, if you want to go ahead and dive into that information, please go ahead and sign up for the education and training webinar coming up with Mo Health Net, where they can cover all that information in depth and give you all the ins and outs of that. We're just trying to keep it within our 30-minute limit. All right, any other questions? Anything else you want me to go back to? So we have the 3 managed care plans. They all provide the same benefits are covered with all 3 plans. It doesn't matter which one they choose. There's also PowerPoints on the Mo Health Net provider resources and the training resources. There are some PowerPoints already pre-made that you can go in and view, and they'll explain the coverage and the ME codes if you don't want to, if you're not able to attend the webinar, or if you just want to go ahead and get a jump start on that information. We love it when providers just want to jump right in, but we realize that some others need to take it smaller steps at a time. So we have a little time, so I'm going to go ahead and show you. Sorry guys, bear with me just a minute. I'm going to show you that Mo Health Net page because I think a lot of your questions will be answered with that page. Okay, so that link I gave you guys for the Mo Health Net provider resources will take you to this page. Mo Health Net Division Providers Fee for Service. So if you're looking, here's the education and training link. This will take you to the training calendar. This will show you when they have all their webinars scheduled. Right here, if you go down under program specific, these dental resources, this is the presentation that's very, very helpful. As you can see, I have been in here several times, but it will go over everything about dental, all the benefits, everything you need to know. So go out there and check it out. There's a lot of great resources for dental, for if you want to do a live training. This is also where you'll find the fee schedule. This is where you'll find the bulletins. This is your homepage. And when you're really getting started, this is kind of where you're going to spend a lot of time. This has all the information you can need about MoHealthNet. If you go back to just the provider page, you can also click on the managed care option, which also shows you the plans, provider toolkit, and all the information for the managed care plans. So we really wanted to make that information available to you guys and draw your attention to that, because we think that will answer a lot of questions you may have. If you continue to have questions, feel free to reach out to me, and I can happy to work with providers one-on-one to help them through this process and know the difference and what they need to do with each managed care plan. But again, we leave it up to providers on who they want to work with. You're not required to credential with all three plans. You can pick and choose. You can see all of them. You can be a managed care only provider. So whatever suits your practice, it's really your practice, your way, however you want it to work for you, we can do it. What other questions can we answer? So again, we have Amanda with MoHealthNet on the phone today. Is there anything else we can answer for you during this time? We have just a few minutes left. So our next webinar is next week, and that's where we're going to dive into the ME codes and the services covered. So please join us for that if you can. If not, the recording will be available. Okay, there was the question, is there a way to check coverage on the MoHealthNet online? So to check coverage, you're going to use that EmoMed portal with MoHealthNet. And that's going to show their eligibility. That'll show you which plan they're enrolled with, or if they're managed care. That's also where you'll find their ME code, which we'll talk about next week. That's how you're going to know what services they're eligible for. We'll dive into that more next week, but the EmoMed portal is a very valuable resource for any provider, whether you're managed care only or whether you're seeing all of them. That's where you're going to find the information about their eligibility. Especially right now, you have probably heard about the unwinding. If you've heard that term, that right now is when they are going through, all the participants have been kind of locked in to MoHealthNet coverage because of COVID. And now they have lifted that, and they are going back and revalidating all the participants to make sure they are still eligible, to make sure that they're in the right coverage group. So checking eligibility is very important right now. Check that eligibility, especially on the date of service, to make sure you know which plan they're enrolled in. Any other questions? Anything else I can answer today? Amanda, anything I've missed or anything you want to add to this? We got just a couple of minutes, and we're gonna give providers some time back in their day.
Nope, I think you covered everything. Great job.
All right, well, we will be sending out a recap email on Tuesday that it'll have the recording of this presentation. It will have my slide deck. It'll have links to all the resources that I've shared. So be on the lookout for that. Go back and look at the others. If you missed a session, you can go back and see those recordings as well. Next week, we're going to talk about decoding the codes. So all the codes related to MoHealthNet and managed care and what you need to know about them. If there's no other questions, Then I'll give one last call for any questions you may think of. If you think of questions later, feel free to reach out to me. Email, phone, text, whatever works for you, whenever works for you. And I will do my best to assist with those. If I can't answer the questions, I have contacts with people who can. So feel free to reach out to me in any way that you need. But since there's no other questions coming up, we will go ahead and conclude today's webinar. I hope that you can join us again next week when we talk about the codes. But I'll give you a couple minutes of your day back, and thank you for being here. We really appreciate your attendance and appreciate your interest in Medicaid and helping increase access to care. So thank you all for attending, and we'll go ahead and close out for today.